Hello, my name is Victoria Covington, and our lesson today will be about understanding epilepsy. Okay, so our objectives will be to identify statistics of epilepsy and understand how epilepsy is identified. Students will be able to identify the IDEA definition of epilepsy and eligibility of IDEA and ADA while understanding the services that are offered to that individual. Students will be able to identify the causes, symptoms, and characteristics of those who have epilepsy, and students will be able to identify teaching strategies and assistive technology when teaching a student with epilepsy, and students will be able to identify an understanding of a new medical discovery and assess their understanding at the end. Alright, so did you know that Elton John, Susan Boyle, Cameron Boyce, and Marion Clignet all have epilepsy? And they do not let that discourage them or stop them from doing what they love to do. Whether it's acting, singing, running, they all enjoy their activities despite their circumstance. Alright, so some prevalence for you. According to the Centers for Disease Control and Prevention, 470,000 children and 3 million adults in the United States have epilepsy, and approximately 336,000 children have one seizure annually. 1.9% of deaths in people are caused by status epilepticus seizures, which are seizures that are uncontrollable and they keep happening for a long period of time. In Maryland, there are 59,900 cases recorded for all ages who have epilepsy. Between the ages of 0 to 17, there are 7,900 cases, and those 18 and older, there are 52,000 cases. So on the right here, we have a chart from the Centers for Disease Control and Prevention of the United States and the numbers of active epilepsy cases. Alright, so what is epilepsy and how is it identified? Epilepsy is a brain disorder that causes repetitive, unprovoked seizures, and it's identified by the type of seizure that the individual experiences. It's commonly diagnosed through the use of an EEG, which is this picture right here. They're attached to the head, and it identifies the location of where the brain is affected, and it measures the brain's electrical activity. There are other imaging techniques, including a CT scan, a CAT scan, MRI, and a PET scan. So the IDEA definition and its eligibility are right here. It is considered a other health impairment, which is a disorder resulting in limited strength, vitality, or alertness, including in heightened alertness to environmental stimuli, which results in limited alertness with respect to the educational environment that is due to chronic or acute health problems such as epilepsy, but it has to adversely affect a child's educational performance. So if they're not eligible under the IDEA, they could be qualified and eligible for the 504 plan. They are always covered by the ADA because epilepsy is a disorder that affects the neurological system. So down here we have a least restrictive environment. Children always need that. They could get offered an IEP or an IFSP plan for their educational learning, and because they have to take medication, they have to have someone who comes and gives them that medication during the school hours. They can get counseling and specialized recreation services. Okay, so some causes include infection, autoimmune, genetic, metabolic, and structural. They are caused by an electrical dysfunction or an abnormal electrical discharge in the brain. And as I said before, it can result from a brain abnormality, infection, and a brain injury as well. Infection is the most common cause of epilepsy, and it is more common in the developing world. Alright, so some characteristics and symptoms of epilepsy. There are two different types of onset. There is generalized and there is partial. So in generalized tonic-clonic seizures, the first phase, the muscles tighten, the person loses consciousness, and if they fall to the ground. In the second phase, there's violent and rhythmic jerking of the body, of the arms and the legs. In an absence seizure, a momentary loss of consciousness for a few seconds is displayed. Simple partial seizures, it's an abnormal muscle movement or sensory ability. For complex partial seizures, they can last up to 5 minutes. There is agitation and aberrant behaviors or aggression in that individual. There can be eye blinking, facial grimacing, lip smacking, repetition of movements, disrobing, or laughing or crying for no reason. So, besides that, we have characteristics. Usually, a person who has epilepsy suffers with depression, dysthymia, anxiety. They always feel like they're fearful of something. They panic or they have pain. They can have a reoccurring amount of seizures called seizure clusters and epileptic seizures. They can hurt themselves. Their language can be lost. Their memory is an issue. It becomes unorganized, and they have an issue with executive functioning. In females, their bone health is not that good as it is, but they really get osteoporosis and fractures more commonly than males do. But you also can pass away from epilepsy, and that's called a sudden unexpected death in epilepsy. All right, so some innovative teaching strategies. Accommodation is definitely a number one thing that the IEP team will discover for the child. Here are some possible teaching strategies for a general education teacher based on their needs. So you can provide written or pictorial instructions, have a peer take notes for them, and permit a tape recording, use voice recordings or verbal instructions, simplify their larger tasks into smaller steps. Use recognition rather than recalling tasks as decrease in memory demands. Provide extra time for them and modify their workload. It really is important for us future general education teachers to be aware of what they will need, especially when they do have a seizure. But these strategies will definitely help. All right, so some adaptive assistive technology that general education teachers can use in the classroom include memory aids, audiobooks, communicators, and timers. So I have actually personally seen a communicator before, and it has helped this one child that I know who used it for a different disability, and it helped them so much because they were able to communicate better to the teacher. So a new medical discovery that was found in this year by Mick Goldrick. It's called neurocysticercosis, and it's one of the most common causes of acquired epilepsy worldwide. So it's acquired by ingesting larvae commonly affected in pork, and it's found in regions that lack proper food safety and sanitation. After ingesting this bacteria, it infects the brain and it causes a cyst to grow. The infection is not very particular to the United States, but it's responsible for almost 1,000 hospital visitations per year. It is common in Central America, South America, Asia, Africa, and it is primarily in low socioeconomic and rural areas. It's one of the most preventable causes of epilepsy. It affects 50 million people worldwide. Through the use of an MRI, we can identify the location of the cyst, and medication can be administered to the patient for treatment. So neurocysticercosis is it's crazy to think that eating something can cause you to have epilepsy. All right, well, let's see what you know. What is a common characteristic for an individual who has epilepsy? What is a common cause for an individual to acquire epilepsy? What is one assistive technology device that teachers can use in the classroom for a student who has epilepsy? All right, let's see if you were right. The common characteristic is a seizures. There's two different kinds. There's generalized onset and partial. The most common acquired cause is the neurocysticercosis. And assistive technologies include a communicator, audiobook, timer, and memory aids. All right, that is the end of our lesson. Thank you for listening and diving into some new knowledge about epilepsy. My name is Victoria Covington, and I hope you enjoyed this lesson. Thank you. Goodbye.